people here have heard of endometriosis or know what endometriosis is. In recent years, celebrities such as Halsey, who speaks at Endo Marches, Padma Lakshmi, the Endo Foundation co-founder, and Daisy Ridley, an actress, have spoken out on their stories of suffering from endometriosis, trying to change the stigma about women's health issues. There are millions of other women across the globe as well who suffer daily with endometriosis who don't have funds for medical intervention, cannot miss work or school, or lack support during their most difficult days. Today I will be talking to you about what endometriosis is, a disease that affects me personally, emotionally, and physically. I will start by touching on what exactly endometriosis is, how it is diagnosed and managed, and how the standard of care is lacking for all women affected in more ways than one. According to CEC's Dr. Albee, endometriosis is a disease characterized by the presence of endometrial-like tissue found outside the uterus with lesions composed of tissue that somewhat resemble, but is not the same as, the endometrium located elsewhere in the body, causing various pain and symptoms. It is said that endometriosis affects 1 in 10 women, approximately 176 million women in the world, as noted by the World Endometriosis Society. The symptoms caused by endo include but are not limited to crippling fatigue, vomiting, diarrhea, heavy and painful periods, and infertility. There are 4 stages of endometriosis, indicating extent of disease present, but that does not correlate with severity of symptoms. This means that someone could have stage 4, but have the symptoms of stage 1 and vice versa. Moving on to our next topic of testing and diagnostics, women are usually passed specialist to specialist trying to understand their pain origins and also relief options. There are numerous specialists in the US such as Dr. Second, Dr. Cook, Dr. Sinervo, and Dr. Fox and team, to name a few, who are skilled in the removal of endometriosis. Currently, there aren't many ways in which endometriosis can be diagnosed. I said it again. I lost my place. Okay, I'll edit that out. Suspected diagnoses can be made, but the definitive way to diagnose is through latex surgery, which was pioneered by Dr. David Redwine and Dr. Albee. This is a non-invasive procedure to look inside your abdomen and your pelvis with tiny incisions for endometriosis lesions or abnormalities. 2 ways in which endo can be removed is ablation to cauterize lesions with a high probability of regrowth, and excision, coined the gold standard of removal, noted by Dr. Carpinello at the NIH for lesion removal as close to the root as possible, aiming for long-term resolution of symptoms. It is said that reoccurrence with excision is unlikely but still common. My first latex surgery with an excision specialist in 2017 led to further recurrence to remove endometriosis lesions and other abnormalities found. You may recall Dr. Second that I mentioned previously. He wrote the book, The Doctor Will See You Now, and in this he outlines how endometriosis lesions vary in color, such as red, clear, blue, or white, as shown here. It takes years of medical experience and the help of aqua blue contrast created by himself that is placed into the pelvis to highlight endo lesions not easily visible due to varying colors and microscopic size. So you can have red or black lesions that can be underneath the uterus, the peritoneum, on your fallopian tubes, your intestines. It can even go as far as your thoracic cavity, sometimes in worst cases even your brain. Aside from surgical intervention, like in my case, symptoms can somewhat be managed with anti-inflammatory medications, heating pads, ice therapy, physical therapy, but these are usually considered band-aid fixes, which is why the standard of care must change, as discussed further in Dr. Second's book. To jump into understanding why the standard of care is poor, I will begin with the statistic. The length of time from the onset of symptoms to definitive diagnosis is often an average of 6 to 10 years. This delay is even longer in younger patients and severe cases, as stated by Sarah Sherwood. Another reason for a delay in diagnosis is due to insurance companies requiring pre-authorizations, unnecessary testing, and dangerous medications to be taken, all before allowing surgeries to take place. Some top GYN surgeons are also out of network with certain insurance carriers, leading to astronomical copays and inability for some patients to be seen. So when seeking care for endo, doctors or facilities don't take patients seriously and insinuate fabrication of pain. There are many instances of medical professionals belittling patients for questioning treatments or pushing for more thorough care than what they are receiving. Emergency rooms are also unable to help patients due to endometriosis not being life-threatening and unable to be managed non-invasively. Unfortunately for those who cannot obtain relief, disability is not offered, and as a result of this, women are made to feel as if they're crazy, making up their pain, and left to suffer daily. Although endometriosis has been discussed more recently, much more needs to be done to bring awareness to this disease and its sufferers. So as I come to a close, I want to reiterate that knowing what endometriosis is, understanding the current diagnostics and treatments available, and realizing the standard of care must change is detrimental for awareness and for a potential cure. Patients need to advocate for themselves and their health, loved ones need to offer support, and medical professionals need to practice compassion and also offer support. I am 1 in 10, I am an endo warrior, my pain does not define me, and I will continue to wake up every day ready to fight this battle and one day help women like me to give my experience and my knowledge on this disease, and I hope to see in one day a change in the medical community and fight for a cure alongside millions of other women doing the same. Thank you for listening.